Friends, we are going to discuss few multiple choice questions today. The given question is, in which year the Food Adulteration Act was enacted by the Indian Parliament? Enacted means introduced or to make a law. The given options are 1964, 1954, 1944, 1974. The correct option is 1954. The Food Adulteration Act was enacted by the Indian Parliament in 1954. Next question. What is the ideal nurse-patient ratio in ICU? The given options are 1 is to 5, 1 is to 3, 1 is to 1, and the last option is none of the above. In the given question, they have asked the nurse-patient ratio in the ICU settings. In the ICU settings, the nurse-patient ratio is 1 is to 1. In general ward, it is 1 is to 3. In teaching hospitals, and 1 is to 5 in non-teaching hospitals. Next question. Pre-adolescent stage is, the given options are 12 is to 14 years, 12 to 14 years, 19 to 28 years, 14 to 18 years, 18 to 21 years. Here, adolescence consists of three terms. One is pre-adolescence, pubescence, and post-pubescent. The pre-adolescence is also called as late childhood or pre-pubescent. The pre-adolescent age in girls is 10 to 12 years, and in pubescent stage it is 12 to 14 years, and in post-pubescent stage it is 14 to 18 years. For boys, the pre-adolescent stage is 12 to 14 years, and pubescent stage is 14 to 16 years, and for post-pubescent stage, the boys' age is 16 to 20 years. In the given options, the correct answer is 12 to 14 years. Next question. What is the scoring system used to estimate the gestational age of a newborn? The given options are Apgar score, Braden scale, GCS scale, and New Ballard scale. The first option, Apgar score, helps in knowing the physical condition of the baby at the time of birth. The Braden scale helps in assessing the risk of pressure ulcers. Or bed sores. And GCS scale is knowing the level of consciousness of a client or patient. New Ballard scale helps in estimating the gestational age of a newborn or maturity of physical and neuromuscular characteristics of the newborn. So among the given options, the correct option is new Ballard score or scale. Next question. The temperature needed to be maintained in cold chain is option 1 2 to 8 degrees centigrade, option 2 -15 to -25 degrees centigrade, option 3 -4 degrees centigrade, option 4 -2 to -8 degrees centigrade. In the given question, cold chain refers to or cold chain means the temperature that is maintained for the vaccines from the point of manufacture to the point of the vaccination site. Point of vaccination site is called as cold chain. The temperature maintained here is 2 to 8 degrees centigrade. So the correct option is option 1. Most of the vaccines except polio and measles are maintained at 2 to 8 degrees centigrade. Except polio, OPV and measles. OPV is maintained at OPV and measles are maintained at -20 degrees centigrade. These are most heat sensitive. Next question. According to iceberg of disease concept, floating tip of the iceberg represents which of the following options? Option 1, undiagnosed cases. Option 2, clinical cases. Option 3, cases in window period. Option 4, carriers. In the given option, floating tip refers in the given option, floating tip. This is the iceberg. This is called as floating tip of iceberg. This is the submerged portion of the iceberg. The floating tip refers to the clinical cases. And the submerged portion refers to the undiagnosed cases or hidden cases. In the given options, option 1 is undiagnosed cases refers to submerged portion and the clinical cases refers to floating tip of iceberg. So the correct option is option 2. Next question. Sex ratio is defined as option 1, the number of males per female, the number of males per thousand females, option 3, the number of females per thousand males, option 4, the number of females and males birth to the parents. Here, the sex ratio is defined as number of females per thousand males. For example, the sex ratio is 900 means there are only 900 females per thousand males. So among the given option, the correct option is option 3. Next question. Which of the following is responsible for central supply in a hospital setting? Option 1, lab services. Option 3, pharmacy services. Option 3, free diet. Option 4, supported services. Here, the Central Sterile Supply Department. Central Sterile Supply Department means CSSD. It is an unprofessional service or supply. Which supplies sterile articles to the departments in the hospital. The correct option is option 4. Thank you for watching the video. If you like the video, please